For Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Welcome to Countywide. As always, I'm Paul David. It's great to have you in studio with us today. We are sitting down with Yavapai County Community Health Service Director Leslie Horton. Welcome to studio.
Thank you for having me here.
Face to face for the first time.
That's right. We've done a lot of phone interviews.
We have. Whether we're just doing a news story about what's going on with COVID-19 or we're doing a Countywide with you for COVID-19, yeah, we've been doing them over the phone. So it's nice to have you in studio and actually see you face to face. Yavapai.us is the Yavapai County website. I say that a lot. I probably sound like a broken record when I say that, but that will take you to Yavapai County's website, and from there you can get all the information about what's going on in Yavapai County, including COVID-19 and what's going on with the health department. I wanted Leslie to come in today because I've had people say that, oh, I don't listen to the news anymore. COVID-19 is everywhere. That's all I hear. I just don't want to hear it anymore. And I've got people who were listening way at the beginning, but information has changed because we know much more about COVID-19 than we did back in, I'm going to say mid-February. Stephen Everett was here. The epidemiologist for Yavapai County Health Department was here, and he was talking about Wuhan, China. He talked about the little animal that had the virus in it, and it jumped off that animal onto a person, and then we know how the story went from there. Is that still the story? Let's start with that one right there. Is that still the story?
That's a good question, and I don't know how long it'll be until we actually know the truth of where it originated. They do think that there was a genetic link to the pangolin, the little animal that you're talking about, and that there is some science that says that that could have been the source. And then there's a lot of other science that's conflicting as to where it came from, what actually happened. I think that, we do know that it originated in Asia somewhere and affected Wuhan first in terms of how it originated. And then from there, I feel like the source doesn't matter as much at this point. We'll find out someday where it actually originated. But, the progression of it is really important to know and know what's working as we look at it affect the world and different nations and how each has handled it so differently. It's important to look at those things to know how we should react, how, if what we're doing is working, if, we're able to contain it quickly. And, some countries, as we've seen, have acted quickly, contained it quickly, and they've done a great job. In our nation, we did act rather rapidly in terms of trying to lock things down quickly and make sure it didn't spread a lot, and that's worked better in some areas and less in some areas. So
I guess it really doesn't matter where it came from at the moment. The fact of the matter is it's here, and it's been here for a while, and it's made 2020 the worst year ever at this point in time. For me, 2020 is the worst year ever. Is there any other misnomers that we knew back in February, March that have changed to now? The one that I hear a lot of, and it is wearing a mask a good thing to do? Because for a while we heard that, okay, so maybe I have it right now and talking to you, just me projecting, could possibly give you the virus, although I'm not showing any symptoms of the virus. How is the transmission part of it?
There's a lot of varying information. I think that's where some people decided to filter out information because there was so much out there. Wear a mask, don't wear a mask.
Gloves, no gloves.
How do you catch it? It's, you can catch it from, just anywhere, or do you have to be close enough to someone to catch it? And that is a good question. With masks, if I wear a mask, it protects you. So if I'm coughing or sneezing and I have a mask on, it's going to keep those germs here. If you're wearing a mask, it protects me. And if we're both wearing a mask, it does cut down on transmission by a lot. Because about 50% of cases are asymptomatic. So you could have it, never know it. I could have it, you wouldn't know. We're feeling good. We're, here talking and not having any symptoms, but could be carrying it. So if I have a mask on, it would help some level of protection. However, we find that people touch their faces more. They fiddle with the masks a lot. There's a lot of, rub their eyes, which the eyes are where you can also catch it. So having a mask on, you still have some vulnerability there. And then you see people take off the mask, eat a sandwich, lick their fingers, do things. And It's really hard to say. That probably the biggest mode of transmission for this virus is touching something that someone else touched who was sick, and then touching your mouth. And so it's kind of that hand-to-mouth movement. And so there is some evidence that mask wearing works. If you look at the hospital and YRMC and VVMC, they've tested a lot of their staff. And when you look at the rates of positive there, where they've been dealing directly with COVID positive people, they're very, very, very low rates of positive. And even in those ones, sometimes those are people who didn't have patient contact. They may have caught it somewhere else. And so wearing proper PPE does work. But physically distancing, if you're not close enough to catch someone's virus or to breathe their air, you're a whole lot safer than even wearing a mask. And so if you keep those 6-foot distances, physically distance yourself, that's probably the best way, is just not to get close enough to people to catch their virus, and to wash your hands often. So if you have touched a contaminated surface, you're not getting that into your mouth.
Okay. The flu. People say this is no worse than the flu. The death rate for this is similar to what the flu is, and it's like having the flu, so why do we shut the country down? Is this like the flu, COVID-19?
We're finding that it's a little more severe than the flu. So there is, it takes a while to get that information. We see the flu every year, and about 30 to 60,000 people die every year from the flu. And yet here we are over 100.
Is that United States or worldwide?
In the United States.
United States, okay.
So in the United States, about 30,000, sometimes up to 65,000 if it's a really bad flu year. And yet here we are over 100,000 in deaths in the U.S. So this is rather deadly for the really vulnerable populations. So when you look at nursing home populations, people with very advanced age, underlying health conditions especially, this one is rather deadly. But sometimes in the way that we look at it too, it can be less affected, or can affect people less if they're healthy, young, and people were seeing a clear delineation between people who are very healthy, whether overall have no underlying health conditions and take care of themselves. They're far less sick with this. They're a lot of times, about half of cases are asymptomatic. People who are elderly with underlying health conditions, or even of middle age with underlying health conditions, they get far sicker with this. And so flu tends to affect, depending on the strain, some affect more children, some affect more adults. It can be very deadly still for those people with underlying health conditions who are elderly. But this is a little different. It's not the flu. It affects people differently. And with flu, we don't see so many asymptomatic people. So that's where that contagiousness increases, because you've got a lot of people walking around with it who don't know they have it and could pass it along. And so if they're, eating with friends, go shake someone's hand, and it can pass that way pretty quickly without them knowing. And people, we find that they're contagious a few, 2 to 5 days before they actually come down with symptoms, if they come down with symptoms too. So you've got a longer period of contagiousness, and then more ability to pass that on than when you don't know you have it. Whereas flu, you get, exposed to it a lot of times within a few days. You are really, really sick and you're staying home because you've got the flu and you don't want to infect others and you need to take care of yourself. This one's a little different in that you could have it and not be very sick or not know you have it at all.
Yeah, he's sneaky. COVID-19 is a little sneaky. We'll take our first break. Yavapai County Community Health Services Director Leslie Horton in studio with me today for Countywide. Yavapai.us is the website. Stick around. We'll be back in just a couple minutes.
Orkin has pest control down to a science.
When your business chooses Orkin's Precision Protection Program, you get a tailored pest control program for your specific industry and environment.
Your business can benefit from over a century of experience, training, and scientific knowledge that define the Orkin man.
Maximum protection, minimum exposure, backed by one of the industry's most comprehensive guarantees.
Choose your locally owned and operated Northern Arizona Orkin and get more than an exterminator. Get an expert.
Award-winning Soundbites Grill is an entertainment restaurant located in Uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family friendly, open 11:30 to 9. Late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Are you struggling to overcome an addiction, depression, insomnia, or a weight problem? Then it's time for you to meet with Dr. Elaine Kissel, award-winning, world-renowned hypnotherapist, author, and mind trainer. Now you can get her help from the privacy and comfort of your own home. Let Elaine Kissel create a personalized hypnotherapy plan to overcome your problem forever. Call 844-4KISSEL now for a discounted evaluation appointment. That's 844-4KISSEL.
So, I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
Welcome back to County Live. We're sitting down with Leslie Horton, Director of the Yavapai County Health Department, talking COVID-19 and just getting an update, basically, from you on COVID-19. Real quick, one question I heard this morning that maybe COVID-19, since it started, that it's kind of losing its punch. And I was telling you during the break, it's kind of like I tell you a story and you tell 10 other people that story and they whisper it down the line. By the time it gets back to me, it's not quite what it was before. Is that happening with COVID-19 at all?
In terms of the actual health ramifications of it, I haven't heard that it's losing severity in terms of how it can affect you. Now, I do think that in the beginning of this, people had a lot of fear, a lot of anxiety. We watched this pandemic start out across the world from us and kind of work its way towards the U.S.
It looked like a Hollywood movie.
It did. And you'd see these maps and they would turn red as it was moving our way. And there was a lot of misinformation as well as factual information that created a lot of fear in people of this virus. And so I think where we see a lessening of severity is people kind of getting used to the idea, okay, well, this is here. It is affecting us. There are some basic strategies to keep yourself from getting it. There are some protective measures you can utilize, and they're simple: hygiene and physical distancing, and not touching a lot of things, washing your hands, all those things.
Sure.
Wearing a mask if you need it. So I think in some people's minds it is less severe. They're starting to see that it's not killing as many people as we thought it could. Except that we still don't have a vaccine, we still don't have a cure, so that we are going to have to somehow learn how to live with it in our world, but still kind of, as we're reopening, go back to somewhat normal life. And so I think people are kind of coming around to the idea, okay, well, we're going to have to figure out how to live with COVID in the community until there's something, that does have a relatively good cure or prevention that is absolute and can stop the virus.
Exactly. So it still remains the case is that we're trying to, we can't really stop the spread. That's next to impossible. There's just too many of us on the planet. But to slow the spread, that is to, I guess, benefit mostly the hospitals, to keep the hospitals from becoming overwhelmed.
Right.
So if we could just slow the spread and keep it kind of steady, that's good. We're also looking for herd immunity. That just popped into my head. That is one thing we're really looking for, is herd immunity, where the majority of us have it, and then we can protect everybody else from it.
Right.
And keep ourselves from getting it again, too, hopefully.
Yeah, as a public health director, we preach herd immunity through things like immunization and other means, and in a lot of cases with mild colds, you try to create a level of herd immunity that, those who are resilient and will live through it easily and get through it, they will actually create those antibodies and by fighting it off and effectively create antibodies that make themselves immune to most viruses or colds. And then what that does is if a bunch of healthy people get these viruses, colds, or immunized against them, then you have that herd immunity that protects those who either can't be immunized or, in this case, need protection are vulnerable populations, those in long-term care facilities, those who are elderly with underlying health conditions. You hope that the rest of the population protects them. Now with this, as we're starting to roll out antibody testing, we don't know for sure if antibodies, if just the fact that you have antibodies, if that's a long-term protection from this. We have seen in very small studies and stuff that there are some people who have gotten this more than once. So they're seeing that people have had it, tested negative, and then tested positive again later at a time. But that's a very small minority of cases. And so for the most part, we think that if you have had this, you probably won't get it again. However, when we're doing antibody testing, we're only seeing about a 1% positive antibody rate amongst those who have been tested.
Oh.
So that's not great herd immunity when you look at it. You want that percentage way up higher than that, over 50%, hopefully.
Oh yeah, 1% is very small in the world we live in today.
Yeah.
Let's talk about reading the chart. There was a report that said there's been huge spikes in Arizona. And we have seen numbers go up, and I've also been broadcasting the fact that we've been doing the blitz testing for the past few weeks, which was not something that was done in, I want to say, late February, March, April.
Yes.
But May was the big month that a lot of the testing took place, because I was even including that, okay, there's been 100 and some odd thousand people tested, but keep in mind there are 7.2 million people in the state of Arizona, so that's a really very small portion of people. But now the testing has really ramped up over the last few weeks. And so we have seen our numbers. Can you address some of that for us?
Yeah, so in our county, it looks like we've had about 11,500 people tested, so close to 11,500. And of those, we've seen, over 300 people test positive. So our rate of positive is rather low amongst these tests. So in Arizona, 336,000 people have been tested. And so in the beginning of this, back in March, just after people were returning from spring break, that's when the schools were closed down. That's right when we were starting to get testing in rural Arizona, at least. They had started doing a little in the bigger cities prior to that. And so we started seeing readily that this was already in our communities with testing, but it was still pretty low rates here. We are seeing, though, across the state, over time, there's been spikes in different areas. As we heard recently, the Navajo Nation was heavily affected for quite a while, and they still are seeing high numbers of positive tests on the Navajo Nation and the surrounding communities. And yet, just recently, we have been starting to see spikes in like Maricopa County case numbers in Yuma and some of our border communities. There's higher numbers. Some of our counties like Apache have had higher numbers, and you're seeing kind of a spike in cases that has been a little later in the game after we've had some of these measures in place, and yet we have had a lot of people tested and are still, overall, our rate of positive is rather low. It's just hard to predict in any one place when you're going to see those spikes. We had really low case numbers until May, for the most part, and then we started seeing, right at the end of April, we started experiencing that outbreak at Mingus Mountain Academy, where all of a sudden, now within a month, our case numbers are 200 higher. But a good proportion of those were just out of an isolated outbreak there. So we're back down to seeing 0 to 1 to 2 cases a day now this week.
Okay, I got to take that break already. Yavapai County Community Health Services Director Leslie Horton in studio today. Again, yavapai.us is the website. Stick around, countywide, back in just a couple minutes.
From inspiration to installation.
If you need help with your decorating plan, call the pros at the Picture Window. We are your #1 source for top quality blinds, shades, shutters, and flooring. We've been in business here for 41 years, and our delightful sales staff has decades of experience. We're the locally awarded Best of the Best in both Sedona and the Verde Valley.
Don't pass up a free estimate on your project. Call the Picture Window now.
Paul Stanley here with Stanley Steel Structures. We offer shade structures that provide style, value, and performance. Our Equinox louvered roof opens and closes to give you the ultimate patio experience. We also offer Alumawood shade covers that looks like wood but lasts like steel and never needs painting or maintenance. Visit us at StanleySteelStructures.com. Contact us today and be covered tomorrow. Stanley Steel Structures. Let us add some space to your place.
Been hearing about the crazy benefits of CBD? Find out how CBD can help you at Sedona's #1 resource, CBD Sedona. Come in for a free consultation and let our trained medical staff help you find the perfect product for you. Pain-relieving salves, full-spectrum oils, honeys, teas, cookies, and even CBD for pets. Ready to feel fantastic? Come on by CBD Sedona today.
Turning your real estate dreams and goals into reality, I'm Claudel Johnson with Berkshire Hathaway Home Services. For more than 7 years, I've helped both real estate buyers and sellers put me and my team's extensive knowledge of the Sedona and Verde Valley area to work for you. Come see a 4-bedroom, 2-bath home with a 2-car garage. 110 Sagebrush Way in the wonderful Cottonwood Ranch subdivision is recently remodeled and waiting for you. Call us today and turn your real estate goals into reality. Claudel Johnson at Berkshire Hathaway Home Services of Arizona.
Welcome back to Countywide. Just a couple of minutes left of the program. Leslie Horton from Yavapai County Health Department is here. I've noticed we're running out of time already, and I've got a billion questions for you still. But I have noticed that the sites are putting in recoveries.
Yes.
Now, in order for somebody to be recovered, before the show started, you told me it's about a month. So if I'm diagnosed with COVID-19 at this point in time, is it a month from today? As soon as I get that positive result, then you contact me and ask me whether or not...
If you're feeling well. If if you ever had symptoms, we're getting information that way. It helps us to know if someone's feeling well and is deemed recovered, but also what was the progression of their illness. Between the time they were tested, were they sick? Were they asymptomatic? Did they have complications? And those kind of things. And so within our recovery numbers, we do wait a month. And that is because we found that early on with this, some people would feel recovered at 2 weeks, but then maybe have some lingering aftermath or complications later. So we wait a month or 4 weeks, and then we make a call and talk to them about how they were doing. You can, in some places, they retest someone to find out if the virus is gone, and if they're feeling well, then they're deemed recovered. And we don't do that follow-up testing. We find out through conversation how they're feeling. And if we feel like there's a need for retesting, if they're still ill or anything, the hospital has seen people actually remain positive for this for longer than 2 weeks, for 3 weeks, 4 weeks in some cases, but it's very rare. So we wait a while, we make sure that they're free and clear and back to feeling like themselves again, at least, or if they never got sick, that they are actually recovered. In some places you'll see that stated as a survivor rather than recovered.
Okay. The reason I bring that up is because when you look at the number, like last number I saw for Yavapai was a little over 300 cases, but then you look at the number right after that, and about half of those cases are recovered cases. So there's actually 150 that are being dealt with. And then I noticed this week also that hospitalizations have never really skyrocketed in Yavapai County. We're out of time. We've only got like a minute left.
Right.
So, but I've noticed that the cases the amount of cases that are actually in hospitals right now for COVID-19 are pretty limited in Yavapai County as well. There's maybe one or two here and there, and then there's cases that are being watched just in case they do have to be, or they're in a hospital, but they're not necessarily in there for COVID-19.
Right. We have people that are hospitalized. This week we actually got to the first point since March that we had 0 people hospitalized. And so that's great news. That shows that we're doing a good job protecting those most vulnerable, those who would have complications and end up in the hospital. And so it's good news for Yavapai County. Not necessarily the same across the state in some areas, but we're hoping that they get to that place too. And
that's what we need to keep doing. The social distancing, the good hygiene, just like you hear during flu season or anything else. It's like COVID-19 is not going anywhere. It's here. It's here.
That's correct.
It's here.
We don't have a vaccine. We don't have a cure. We need to learn to practice those things we've been preaching. They're very simple. Physical distancing, hopefully 6 feet apart for the most part. We have to get away from shaking hands for a while here, but washing our hands often, using hand sanitizer if you need to, and making sure that if you're vulnerable, that you protect yourself. Making sure that those people who know they have underlying health conditions are taking extra measures to be careful.
Okay. All right. That's all we got time for, unfortunately. Leslie, thank you so much for coming in. I appreciate it. We'll have her back. We'll have you back. I got to get Stephen Everett back in here, too. But the website, again, yavapai.us. Go ahead there and research it and go to the Arizona Department of Health Services site, too, and you can see the whole state and what's going on statewide. So that is today's Countywide. As always, thank you so much for watching and listening, and we'll talk to you again next time.